Okay, so it's July the 15th. We are Saturday, and tonight episode is navigating medication. So it's almost the end of this 10-part episode series. There's gonna be 3 more episodes, and it will be over for navigating depression and anxiety, finding light within. So tonight's episode, navigating medication, an episode dedicated to discussing the role of medication in treating depression and anxiety, including common types, potential side effects, and consideration for medication management. So welcome back. Today I'm going to dive into this important topic, medication for treating depression and anxiety. I'm going to explore with you my listener roles, common side effects, and consideration for effective medication management. There have been psychiatrists that specialize in mental health. They highly recommend to also take medication, going hand in hand with your lifestyle choices, how you can build a supportive network, and coping with different techniques to remedy your depression, your anxiety. So of course, medication can be a valuable tool, in managing your mental health conditions. Some medication help regulate brain chemicals like serotonin and norepinephrine, which can eventually become imbalanced in certain individuals dealing with depression and anxiety. So they say that medication can alleviate the symptoms, making it easier for the individual to engage in therapy and other self-care practices. So now let's address common concern about medication, the side effects. So what can I shed as light on this topic? So like any other medication, the antidepressants and anti-anxiety medications may have side effects. Most likely they will have side effects. So they can vary widely, ranging from mild to severe. So the common side effects include nausea, drowsiness, weight changes, meaning either you're gaining weight or you're losing weight, and also some sexual difficulties. However, it's also important to remember that not all individuals experience side effects, and they may subside, meaning the side effects, after the body adjusts to the medication. But of course, it's very crucial, super important to always consult with a healthcare professional for a personalized assessment and also for a management plan. So let's discuss the consideration for managing medication effectively. What I want you, my audience, to be aware of. So firstly, always follow your healthcare provider's recommendations. Your healthcare professional is supposed to know exactly what he or she is talking about when it comes to medication. So you follow his or her recommendations regarding the dosage and also the timing, meaning when you're supposed to take the medication. And of course, consistency is important for the medication to be effective. Secondly, never be afraid to communicate openly about the side effects or any concerns that you may have. And if you face any difficulties, you have to speak to your doctor. Your healthcare provider will adjust the medication or suggest alternative options where you can go to holistic medicine, for example, and use homeopathy. My mom used that for many, many years when I used to live in France. So remember that finding the right medication and dosage often involves trial and error. We have seen it. So just be patient. And lastly, never abruptly, meaning all of a sudden, stop taking your medication without your doctor supervision. So this can lead to withdrawal symptoms or a relapse of symptoms. So now let's shift gears and explore alternative approaches. I'm going to touch on the role of medication in conjunction, meditation in conjunction with medication. So meditation techniques such as mindfulness, which I spoke of in my previous episode, and I will talk about it again in the future. Mindfulness and meditation, I would make a video and it would be very thorough. So mindfulness, deep breathing, all this can incredibly benefit for managing your depression and anxiety symptoms, because they promote relaxation, it reduces stress, and also improve overall well-being. And many individuals find that combining medication with meditation and other holistic practices yields excellent results. So it's important to discuss these strategies, including meditation, with your healthcare provider to ensure they align with your specific treatment plan. So I'm going to offer some advice for those navigating medication for depression and anxiety. So remember that if you are taking medication is just one component of a comprehensive treatment plan. It's very crucial to combine it with therapy, self-care, and healthy lifestyle choices. Remember how I mentioned yesterday about lifestyle and mental health, how your lifestyle impacts your mental health? So just remember that. And if you haven't listened to yesterday's episode, please do so. It's episode 6 of this 10 episode series, and it was July 14th that it was uploaded. So the most important thing to remember is that you need to seek help, because that's a sign of you being strong, actually. And remember that you are not alone. There's a lot of people struggling with mental health illnesses here in this country, in America, and there's always hope for recovery. I am living proof. Me today, Nyama, I can tell you, I used to suffer from depression, anxiety, panic attacks. I used to have nightmares, literally me in my dream, crying, running away, seeing my ex trying to reach out to me and trying to come at me to kill me. So yes, I'm sharing my story so to encourage you and empower you, as well as to inspire you and to know that you are not alone. This too shall pass. It's very overwhelming. I'm sure it can be super stressful, but you need to take care of yourself. Your mental health comes first. So I hope you have a better understanding of medication when it comes to depression and anxiety. And remember to always find the right balance between medication and other holistic approaches, because this can lead to a path of wellness and also increased well-being. So I have a person that asks, how do I know the medication I was prescribed for depression and anxiety are the correct ones and will make me feel better? Okay, understanding whether the medication prescribed for depression and anxiety will be effective for you is a collaborative process between you and your healthcare provider. So I'm going to give you a few key factors to consider, and thank you for asking the question. Number 1, initial assessment. So your healthcare provider should conduct a comprehensive assessment, including a discussion of your symptoms, your medical history, and your personal circumstances. So this information helps determine if medication is warranted and which specific medication may be the most appropriate in your case. Number 2, consultation and open communication. So engaging in open and honest conversations with your healthcare provider is crucial. share your concern, your doubts, and also your expectations regarding the prescribed medication, because this dialogue will allow your provider to better understand your needs and also make adjustments if necessary. Number 3, trial and error. We're human beings, remember that. We make mistakes. So finding the right medication often involves a process of trial and error. So it may take time and multiple adjustments to dosage or medication type to find what works best for you. So just be patient and continue to be persistent, because everyone's response to medication can vary and is different. Number 4, monitoring and evaluation. So during the initial stages of taking medication, your healthcare provider should schedule regular follow-up appointments to assess your progress, monitor any side effects, because this allows for ongoing evaluation and adjustment as needed. Number 5, personal experience and intuition. So you have to pay close attention to your own experiences and also to your intuition, because your body is always talking to you, always warning you, always giving you signs. When you're taking medication, pay attention to your body, not any symptoms, any changes in symptoms, overall mood, and also side effects on your skin. If you start seeing a rash or somewhere it's itching you, it's essential that you trust your instincts and also share right away your observations with your healthcare provider. Number 6, adaptation period, meaning that it's important to remember that medication often takes time to work inside your body and going through your brain cells. So it may take several weeks and some medication even months before you can see noticeable improvements in your symptoms. So just be patient, like I said earlier, and maintain an open communication with your healthcare provider during this whole period. And last but not least, like I said yesterday in the podcast, lifestyle and self-care practices. Combining medication with therapy, self-care practices, and lifestyle changes that can enhance, and that most likely will enhance, the effectiveness of the medication. So engaging in activities like exercising, mindfulness, breathing techniques, and healthy coping strategies, all that will contribute to your overall well-being, and it will support the medication's positive impact on your mental and emotional well-being. So just my beautiful sister, my brother, if you're listening, just remember that each person's response to medication is unique, and what works for one person may actually not work as well for another. So make sure to speak to your doctor, and your healthcare provider is there to support you. Make sure to have a good healthcare provider that truly care about you throughout this whole process. So please don't hesitate to ask as many questions as you want, discuss concerns, and also collaborate to find what is most suitable as medication for your needs. Thank you so much for listening. That's the end of the podcast episode today, Navigating Medication, and the episode dedicated to discussing the role of medication in treating depression and anxiety. Tomorrow podcast episode will be Overcoming Negative Thoughts and Patterns, Strategies for Challenging Negative Thinking Patterns and Building Positive Self-Talk to Improve Overall Mental Well-Being. You know, in this channel, it's all about empowering you to be the best person, the best version of yourself. So continue watching, listening to my other videos on my other podcast, What Have You Learned podcast, Books for Life podcast. And just as usual, stay blessed, stay learning, stay focused, be unbreakable. I am your host, Niema, and my friends call me Nia. Until next time, bye-bye.